we cannot work as silos. We have to keep working all together. So from global health to One Health to planetary health, these are all frameworks that we can apply. But in the end, what we need to do is to collaborate. Because the issues, the challenges we are facing are always the same. So even if we have different lenses, I think that collaborating is the most important thing right now.
Welcome to the Planetary Health Lab podcast, where science meets whole person healing. We interview top experts in integrative wellness to bring you vetted, evidence-based tools for mental and physical well-being. Because when we align human health with planetary health, we all thrive. On today's episode, biotechnologist, global health researcher, and science communications consultant, Laura Moro, shares with us her expertise on how planetary health, the biodiversity crisis, ecosystem collapse, and climate change are impacting human health more than we realize. From the rise of previously eradicated infectious diseases across countries to nutrition and respiratory health, our individual well-being does not exist in isolation. It is deeply rooted in the connection to the health of our surrounding environment and our Earth. In order to protect ourselves, we must first prioritize our planet. So, Laura, can you tell us a bit about yourself, your background, and your story?
Yeah, hello everyone. Thanks a lot, Austin. Thanks for hosting me. So I've been always very curious. So when I heard about a new bachelor's degree in biotechnology, which integrated knowledge from biology, medicine, chemistry, engineering, and other sciences, I decided that I wanted to study that. And at the University of Salamanca in Spain, where I studied, biotechnology is mostly focused on biomedical applications. So while studying, I had the opportunity to start doing research related to diseases affecting large numbers of people, such as cancer, for example. And after my bachelor, I decided to continue doing academic research. So then I moved to Barcelona to do a master's in biomedical research, which was a prerequisite then to do a PhD. I did my PhD at the Barcelona Institute for Global Health with a focus on infectious diseases and maternal-infant health in low and middle income countries. And that was really only the beginning of my passion for impactful science that can be translated into real-world applications, and for contributing to ensure health equity, access, and better health worldwide. So after this experience in the academia, I was awarded a renowned European fellowship called Marie Sklodowska-Curie to do a postdoc at the interface between academia and industry to develop new diagnostic tools for infectious diseases. So during that time, I realized that I wanted to have like a broader perspective on global health topics, and I left the Well Lab to become an independent consultant. Then I studied 2 more masters, one in science communication and journalism, and also an executive master's in health management and innovation. And in 2017, I established my own consulting firm working in global health.
It's a hell of a resume. I love that mission, though, using practical science in order to help out in all different areas. That's amazing. So, I mean, you touched on it a bit, but can you break down a little bit more detail, or in a little bit more detail, what a biotechnologist is? Also, science communications, interesting. I had never really heard of that field. Can you, in layman's terms, kind of lay it out what both of those things mean and why they're so applicable?
Sure. So biotechnologist is somebody specialized in the field of biotechnology. So what is biotechnology? Biotechnology is really a multidisciplinary field that integrates natural sciences and engineering to achieve the application of organisms or their parts for products and services. So it may sound like something very novel for some people, but biotechnology has really been with humans since the Neolithic, more or less 10,000 years ago, when we started producing, for example, fermented products such as beer using yeast or yogurt using bacteria. And there are really many biotech applications nowadays. For example, the production of insulin for diabetics, or the production of therapeutic antibodies for cancer, or even developing bacteria that can eat oil to clean an oil spill. And more modern biotech applications that you might have heard of, for example, what we call culture meat or lab grown meat. So biotechnology is really everywhere. And then coming back to nowadays, I work as an independent consultant focusing in global health. So, what I do is I provide advice and support to organizations that are working on health issues that transcend national borders. And there are so many relevant health issues that are transcending national borders, such as infectious diseases, for example, malaria or COVID-19 or Ebola, or what we call non-communicable diseases such as cancer, but also air pollution or other environmental threats, mental health, and many others. And because of my background, I mainly specialize in infectious diseases, maternal-infant health, and healthcare access. So with these organizations, I'm doing different things, and this includes communication of their results to ensure that they arrive to other experts and also to lay audiences, and to ensure that they have the impact they deserve.
Gotcha. Okay, that makes a whole lot of sense. This is one of those things I feel like that impacts everybody without even really realizing it. Is there something like the average individual might be able to implement day to day based on what you've researched or what you've learned to have better overall help our health and wellness or planetary health and wellness in general?
Yeah, so as I was mentioning, my work as a global health consultant is really varied. So I work with research institutes and universities, international organizations, NGOs to provide them support in communication, but also in management and evaluation of projects, or if they need to do some desk research, provide some training, and with a focus on global health topics. And what I've learned during these years is that health really doesn't understand borders, as we saw, for example, with the pandemics. And this is why global health research is so vital, because the challenges we are currently facing, which include pandemics or pollution or even food insecurity, are all deeply interconnected. So when we invest in having better health systems or in preventing diseases and promoting sustainable practices, what we are doing is also improving individual lives and supporting the health of our planet. So it's really all interconnected.
Definitely. Would you be able to lay out an example of a better system potentially, or something that you've been working on maybe in like the last couple of years? Like an example of what might be a better way to run things or sort of where to head in our future?
Yeah, so for example, one key takeaway from everything I've studied in health during my career is that prevention is really a powerful tool. So, small, consistent habits, for example, staying active or eating nourishing food, getting enough sleep, managing stress, all can help prevent many chronic conditions even before they start. So, we often think of health as something that we fix only when it breaks, but it's really something we build every day. So if we make movement and a balanced nutrition and mental well-being a regular part of our lives, we are not just avoiding illness, but we are also creating the foundation for longer and healthier and happier life.
I like that. Starting with the basics essentially and the fundamentals and working from there. At more of a large scale, is there a way that we'd be able to help kind of create these systems or prevent, like you said, the spread of infectious disease? Was there anything you wanted to speak towards as far as, again, kind of the overall system?
Yeah, so definitely going back to our topic of planetary health, something that I'm really passionate right now and interested right now is this link between the climate and biodiversity crisis and human health. I think we are not talking enough about how rising temperatures and extreme weather events and pollution and ecosystem collapse in general are already affecting everything regarding human health. This includes infectious diseases, as you mentioned, but also nutrition or respiratory health or many other conditions, because our health really doesn't exist in isolation. So it's something deeply connected to the health of our environment. And I would really love to see more awareness and more discussion and action around this intersection, because protecting the planet ultimately means protecting people too. So I'm fairly convinced that all decision making, whether it's in policy or business or healthcare or other topics, should already be taking this interdependence into account. And we are not seeing this yet enough.
Yeah, it's interesting. We seem to always forget that we are part of this planet. We're just mammals. We're pretty smart for monkeys, but we're still just monkeys wandering around on this thing, figuring it out. At an individual level, is there something that we can do to lessen our own impact to kind of contribute to the whole in that way? Maybe specifically through, your background, you might have a specific lens like you're viewing it through, or just a method again that we could all kind of low hanging fruit, if you will, something we can implement kind of day to day to work towards that as a future.
Yeah, so as individuals, I think we have of course, the right, but also the obligation to stay informed and know what's happening around the world, and know where we are heading, because scientists have been saying this, I think, for many decades right now, and we have been kind of ignoring them. So I think it's time to start considering their prediction and their advice. So this would be first thing. And then, of course, as individuals, our actions have an impact as consumers, but also as society. I think we should be asking for more responsibility towards decision makers in the end. No, because of course, individual actions have an impact, but a single individual has a very, very small impact. So I think altogether, as society, uh, an informed society, we should be asking for more informed decisions regarding climate change and the climate crisis, for example, and other global health issues that we have right now.
Yeah, it's hard as an individual, like you said, to make that change. But if we had a full cultural shift and I guess a bit of a value shift as well, that would be really beneficial. Does that start more in, yeah, I guess you already just laid it out. It starts within like the education system.
Yeah, I think education and being informed, although we know that this not enough in many cases, and also um, transmitting just bad news. We know from science communication point of view is not always the best idea. So we should aim to also propose solutions and call people to take action, no, and not just spread bad news.
Yeah, unfortunately, it seems like fear is the one that gets all the clicks and the views. They definitely lean into that for sure.
Yeah, unfortunately. Yeah.
But I don't know. I feel like slowly but surely, we're starting to raise awareness of it. I think people are, like you said, a lot of times people don't take action until they actually feel the impact of whatever is happening. And unfortunately, at that point, a lot of the times it's too late. But I do feel like people are starting to feel that impact a little bit more. How would you recommend us become more educated about these types of topics?
Well, so right now I think it's not easy to find evidence-based information, and there is so much information out there that is really difficult to distinguish with what is real, what is not real. Yeah, always trying to get information from official channels, or, for example, repositories, universities, papers. I know that scientific papers are sometimes too complicated for the general audience, but we have really good tools right now. For example, you can make use of AI platforms to summarize or distill the key messages of a paper. So I think we really need to make an effort to get all the evidence-based information out there in a more clear way, because there is so much misinformation and disinformation around there in social media and everywhere, that this is really concerning also.
That's a really creative use of AI. That's I've never really thought about using it that way, but that's interesting.
Well, I think scientists are doing that all the time because, there are so many papers published every day that it's really, really difficult right now to stay up to date, with publications in a field. So I think we have some good tools now and we need to use them well.
We have access to the information. We need to take advantage and use that for sure.
Yeah.
Awesome. Well, thank you so much for the time, Laura. Was there anything else that you would like to speak to?
No, I think we went through all the questions more or less. I thank you for this nice opportunity of being here and working also with you in planetary health topics. So I think um, uh, we cannot work as silos. We have to keep working all together. So from global health to One Health to planetary health, these are all frameworks that we can apply. But in the end, what we need to do is to collaborate. Because the issues, the challenges we are facing are always the same. So even if we have different lenses, I think that collaborating is the most important thing right now. Coming back maybe to the global health discussion and this topic is that there were many diseases that were, for example, eradicated in one country, and we are seeing them coming back. Or we have many emerging diseases that, with climate change and global warming, are really spreading around many countries. So this is why we need to consider that global health is important everywhere. And so it's not a matter of being in the global south or in the global north. It's really going to affect everybody. So we need to convince our decision makers of the importance of seeing things from this global perspective.
Perfect. I appreciate it. I think we got some really good stuff here, and I really appreciate the time.
Thanks. Thanks. So have a nice day, and it was great to meet you.
It was great meeting you. Have a great rest of your evening.
Bye. 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 Thank you.
Thank you for listening to the Planetary Health Lab podcast. If you're interested in being a guest or you want to nominate someone doing impactful work in the integrative wellness space, we'd love to hear from you. Reach out by email at info@tinyhabitat.com. That's info@tinyhabitat.com. Better health starts with better information. Keep learning with us on Instagram, Spotify, and YouTube. And until next time, we'll see you soon.